And then there is cancer-related genes. So there's a lot of different companies that are doing testing, looking for development of different cancers, and it's extremely important because cancers are not necessarily fun diagnosis. So if we are going to develop cancer, in a way, it's good to know if that's going to happen or if we are at risk. So the most commonly tested genes are the BRCA genes or the breast cancer genes. Then there is genes that are involved in the colon cancer, stomach cancer, pancreatic cancer, even the skin cancers, and many, many more. So without naming all of those genes, I can say that there is a variety of genes. There is a set of panel that can be done, and if we find out that we have mutations in those genes that are going to put us at risk, then many, many things can be done. For example, for the breast cancer gene, if we have BRCA1 and BRCA2, then our chances of developing breast cancer are much, much higher as compared to the general population. But that being said, it doesn't mean that we are destined to develop it, and it also doesn't mean that if we don't have the BRCA genes, we are not going to develop breast cancer, because breast cancer is so common that even in the absence of the genetic mutation, we can be at risk for development of the cancer. So we should just live a healthy lifestyle anyway, but if we happen to have the genetic mutations, then here are a few things we can do. We can make sure that we live a breast healthy life, which means that we maintain our body mass index. So studies show that obesity is a risk factor for breast cancer. Intake of saturated fats is a risk factor for breast cancer. And then of course, exposure to different hormones, especially synthetic hormones, is also a risk factor for development of breast cancer. So we can address all those things and make sure that we do not expose ourselves to those triggers and prevent ourselves from the development of this cancer. Then there is colon cancer and pancreatic cancer and other things. So some of those are going to be actionable, but not all of them are going to be actionable. We can do additional things. For example, we can do preventative surgeries, prophylactic procedures, and make sure that we don't end up in a situation where now we have an end-stage cancer or maybe a metastatic cancer that has spread everywhere and nothing more can be done. So with knowledge, with testing, with constant surveillance, we can definitely improve our health span. We can make sure that we don't fall into the hands of chronic diseases. Thank you.